Hello, everyone. Welcome to a webinar hosted by the American Public Human Services Association, or APHSA, in partnership with Binti. Today's webinar topic is how to leverage software as a service to drive digital transformation in human services. Next slide, please. My name is Alex Claremont, and I'm the Senior Content Writer at APHSA. I would like to take a moment to share with everyone an overview of APHSA and the work we do for and with our members. APHSA is a membership organization that represents state and local human services agencies from across the country through their top-level leadership. Next slide. We aim to deliver for our members through three core channels. Next slide, please. Sorry. Influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publication, and OE consulting practice, and connecting members across a wide array of stakeholders in the human services sector with key partners. Speaking of connecting members, I invite you all to save the date for the next APHSA conference, our National Human Services Summit 2024. At the summit, we seek to highlight and showcase innovative practices and models from state and local jurisdictions. This education conference will be held from June 9th to June 12th in Arlington, Virginia. Again, be sure to save the date and consider submitting a proposal. So, just to highlight some housekeeping items for this webinar. During the presentation, we request that you put your questions for our presenters in the Q&A panel. If possible, panelists will try to answer questions during their presentations, but there will also be time left at the end for questions. In addition, this webinar is being recorded, and it will be shared with all registrants in the coming days. Now, it is my pleasure to introduce the moderator for our panel discussion, Duke Storen, VP of Child Welfare Strategy at Binti.
Great. Well, thank you, Alex, and thanks to the entire APHSA team for your leadership, your terrific analysis of the federal policy landscape, how it impacts state and local human service agencies, and all the great learning opportunities, including this webinar. Binti is a proud sponsor of this session and proud to be your partner in our shared mission to help children and families across the nation. My name is Duke Storen. I'm the VP of Child Welfare Strategy, like Alex said. I'm also the former Commissioner of Social Services in Virginia and the chair of the APHSA Leadership Council. After leaving public service, I came to Binti for a number of reasons. One, their focus exclusive focus on child welfare, their mission, the incredible product that they have, and because I believe that the SaaS business model can truly transform human services IT and accelerate our progress in better serving our families and children across the nation. I wish someone had sat me down when I was commissioner and explained how SaaS worked and the advantages of SaaS to me. So I'm really excited for our conversation today. Let's start by having the panel introduce themselves, and I'll start by turning it over to Felicia.
Great, thanks, Duke. Hey, everyone, I'm Felicia. I'm Binti's co-founder and CEO. It's great to be here. Quick background on me. I started Binti due to a personal connection. My sister adopted 2 children. I've been a CASA for a long time, and I just saw how it was just a really difficult process for families to get through the licensing process, and yet we have such a shortage of families, and we have children sleeping in offices and in group homes. And so that just didn't make sense to me. And so I started Binti originally to try to transform the licensing process and help get more families licensed. We launched in 2017, and our licensing module has now launched in over 450 agencies in 35 states, and we serve about 38% of the country in child welfare, including in 10 states statewide with licensing. But we realized that was really the tip of the iceberg with child welfare, and we've now expanded to placements and case management, most recently family finding and prevention and a full CWIS as well. So I'm excited to be here and really passionate about software as a service and how it can help child welfare and government move more quickly toward better outcomes for children. Thank you.
Great. Thanks, Felicia. Dan?
Hello, everyone. Dan Webster. I'm the Director of Operations at Utah Foster Care. We have been a client of Binti's now for a couple months. We started at the beginning of this last year and got up and running, and could not be more thrilled with our experience and everything we've been able to do since coming on board. And I'm excited to just speak with you all today.
Great. And Marty.
Hi, everybody. I'm Marty Lisko, CEO of Augintel. Little background about me. I came from the corporate world in a bunch of different technology and business roles, and always had a passion for technology and helping people who are in need. And we formed Augintel really to make it easier for caseworkers to provide care for the children and families that they work with, and recognize that one large problem was the amount of administrative overhead they had around case notes and both the collection and review of narrative data. And we formed the company really to address this problem head on, right around the time 5 years ago where AI was able to be customized for particular industries. So we decided to take our understanding of that world and apply it to child welfare to make it easier for staff to do their jobs. And I'll get into more of that later in the presentation, but looking forward to meeting with all of you today and talking about SaaS.
Great. Thanks, Marty. And last but not least, Jim.
Yeah, I'm Jim Darty. I'm the CIO for the Illinois DCFS department. I've only been in public sector for about 6 years now. I came, like Marty, from the private sector a lot in technology for many, many years. And I came particularly to Illinois DCFS to assist in implementing the CWIS solution, which is certainly keeping us very busy. But when we saw the innovation that Marty's company Augintel brought to the table, and we experienced exactly the struggle that they were trying to attack, we started digging in. And so I'm happy to be here with you and tell you how that experience went and the great results we've gotten.
Great. Thank you, Jim. Next slide, please, David. So just to level set about software as a service, this is a model that allows users to connect to and use cloud-based apps over the internet. The common examples in our lives are, email, calendaring, office tools like Google or Microsoft Office suites. I've put up the official National Institutes of Standard and Technology definition here as a reference. I think the key points are that the solution is cloud hosted, it's easily accessible by devices that connect to the internet, and the consumer, or in our human services case, the agencies, don't have to worry about the underlying infrastructure. Next slide. So SaaS has really exploded in the commercial sector and starting to take root in the public sector. Recognizing the inherent advantages of a SaaS solution, HHS has put out guidance to help public agencies understand, assess, and procure SaaS solutions in a way that enables those agencies to purchase with federal funds. So the first two documents on this list come out of the Children's Bureau to help agencies with child welfare technology solutions. The toolkit to help assess SaaS and other cloud service models, and then an information memorandum talking about technologies that are specific to recruitment and approval of foster care homes, and that you can see calls out very specifically the use of COT solutions, including SaaS, and really directs agencies to submit a COTS waiver, which is the third document on this list. Across all the HHS programs that are authorized in the Social Security Act, so your integrated eligibility system that does TANF and LAHEAP and Medicaid, your child welfare systems under Title 4E and 4B, and any of the other programs authorized in the Social Security Act. All of them can draw down and use federal funds for SaaS using the COTS waiver, which has to be part of the APD process that states go through to get approval to spend federal funds. So the bottom line is SaaS is 100% allowed under federal law, and all you have to do as a state agency is submit that COTS waiver. So we can take down the slides now and turn to our panel discussion. I want to begin today by really focusing with Felicia and Marty, hoping you all can tell us briefly a little more about your solutions and why you chose the SaaS model to build your solution. And we'll start with Felicia. Thanks.
Great, thanks, Duke. Yeah, so a little bit more about what we actually do and then why we chose SaaS to do it. So our first module is called licensing. It's for child welfare. It helps families apply online. So instead of applying on paper, families can apply online, e-sign their documents, get through the whole licensing process, and then social workers can track the background checks and all the steps they're doing to license families, renew their license each year. So that's our licensing module. We also have a placements module that matches families with children, trying to keep children with their siblings in their school and community of origin. We have a case management module. Our newest one is family finding, that tries to find more relatives and friends of the family, ultimately trying to keep children with kin and increase kinship placement rates. We're launching a prevention module next year, trying to help agencies increase FFPSA claiming. And we also have a full CWIS that we've built out. So we have quite a few different options. I think and each of them are modular. So a state can decide, I just want to do this one module, or I want to do a bunch of them. The reason we decided to go with SaaS, and why I do think it is the future is, as Duke mentioned, SaaS has really grown tremendously in the private sector, and it makes a lot of sense. It's like, before, if you were building a company, you had to build your own HR software and your own accounting software and your own marketing software. And that was just very, expensive, and you couldn't be great at all of the things. And now there's, accounting software companies and HR software companies and marketing software companies, and you can just pay them less than it would cost for you to build it yourself. It's better than you would have built yourself because they have a bunch of customers, so they can invest more in it than you could. And so, there's thousands of SaaS companies. Many of them are now public companies that have grown in recent decades that really specialize in one area. And the other benefit is you can launch really quickly in those tools because they're already built. So I think government has been slower to shift towards SaaS than the private sector, but it is starting to happen. And it's wonderful, as Duke mentioned, that there is, the COTS waiver and there's funding available to allow for it. So I think, how we think about it at Binti, and I think the benefits are, if you're a government agency and you want to do a custom build solution, you're looking at, $50-100 million, 5+ years. There's a huge risk in the project. Some of the projects fail. There's cost overruns, time delays. There's a lot of change orders. So it's just a very big, expensive, risky project. All of them are custom built, even though there are a lot of things that are actually similar across states. There are things that vary. And so, a lot of them are still custom built. So I think what our approach is with our SaaS model is, instead of custom building in each state, we really study, what's the same and what's different across states, and how can we build the software in a way that everyone can actually use the same software, and then we can quickly configure the things by a non-engineer upon launch. And so, we're able to launch more quickly. We can launch in months instead of in years. And I think Dan can speak to his experience launching with us in that time frame. You're also launching on something that has proven results. So instead of building something from scratch and it may or may not work, you're launching on something that's launched in other states. You can talk to them about it as a reference, and you're launching on something that's proven. It also aligns incentives with the vendor, because I think if you pay $100 million for a project and, a year, 2 years in, you're not happy, you can't exactly go back and say, you know what, let's throw this out and let's go with a different vendor. You're kind of locked in. And so that doesn't align incentives toward continuing to build great things over time. Whereas with us, we actually don't, and with the SaaS model, we actually don't charge anything up front, because we're not building it from scratch. So we don't have upfront cost. It's just a flat annual fee. And then each year we have to stay on our toes and do a good job, or else you could switch. So it just aligns our incentives more, to continue to evolve the product as your needs change, as federal legislation changes, as state legislation changes, etc. We provide unlimited users. Not all SaaS models do. We also do customer support. So we provide customer support over email, phone, and live chat. And I think this is part of what Duke talked about with the SaaS vendor taking over supporting the product. So we have a customer support team, so your team doesn't have to worry about that. And as users are using it, we can chat with them and support them. We also do ongoing improvements at no extra cost. So that's part of the SaaS fee, is we listen and we iterate and add new features, we've never done a change order, for example. And then the last two are, you get benefits of other agencies using the same system. So, Dan and Utah launched more recently, but, we've been live in other states for years. And during that time, they were giving feedback and we were iterating on the product. And when Dan launches, he gets the benefit of all of that feedback and iteration. And then he's going to give feedback this year. We're going to launch a feature. Other people are going to get it too. We'll always make sure it's relevant, but you're getting the benefit of all of that feedback and iteration across the country. And ultimately, you're paying into a system that can be better than you could afford on your own. So Binti is about 100 people. No state can really afford 100 people building, the modules that we have just for their state, but together you can pool in your costs and get a better system than you can get on your own. And then lastly, and I think this is something that's really important, especially for county administered states, but even for states that, just have private agencies. Because SaaS can be more configurable, we can allow kind of like an umbrella view. So, the state can see the data across the whole state, and then each agency can only see their data, and we can do little configurations in each of those agencies that make it feel custom to them, but ultimately rolls up to the state. And I think that can be a challenge in county administered states. If a state kind of launches something, it can seem like you're pushing it down the county's throats if it's just like one size fits all. But if you're able to say, hey, this is the new system, but it can be configured to some of your needs, it can feel a lot better and meet their needs. So I'll pause there. I would love to hear Marty's thoughts as well of the same question.
Well, sure. Thanks, Felicia. Yeah, echoing a lot of what Felicia said around the benefits of SaaS, but I'll take a step back and go into a bit more detail about what Augintel does and the problems that we solve. As we all know, narrative data is most data about children and families, whether it's in a CWIS system or a SACWIS system or other systems that you work with, homeless management systems, EMRs, et cetera, et cetera. And this is the story of the family. It's buried in this data. This is what caseworkers need to know to be able to have that empathetic understanding of the family so that they can provide the highest level of care possible. And the problem is that, there's just too much for any caseworker to spend time reading. If you want to go meet with a family, right, you can either spend time reading through, 10, 20, 30 pages of data, or you can just, sort of wing it or talk to your supervisor. And what we're trying to do is make sense of that narrative data so that caseworkers can get summarized views of what's going on with the family. And when you look at the technology, what's going on underneath the hood is AI technology called natural language processing. And this technology really is the ability of computers to understand the written word. And we focus that technology on child welfare data and social services data, so that what we've built is really a language model that consumes the data that your staff is collecting, the narrative data, and making sense of it, looking for risk factors, looking for protective factors, looking for social determinants of health, early warning signs, the concepts that you want your staff to be aware of when they're meeting with families. And once we've processed the data that's in your CWIS system or any other system, we then present it to staff, and you'll see this during the demo, in really straightforward ways to help them get a very sort of simple but clear view of what's going on with the family, so that instead of reading through those hundreds of pages of notes, they can look at Augantel and figure out what's going on really, really quickly. Additionally, we're helping, in addition to those on the front line, we're helping supervisors, quality specialists, leadership, administrators look at data across cases, across an organization or a program area or an entire department or an entire agency, for trends, what's going on in the agency, areas where improvement might be necessary, areas where best practices should be surfaced and shared, areas where there might be problems with documentation or problems with compliance. All of the sort of content that your quality teams look for manually, we're surfacing automatically with the power of natural language processing. So that's a bit of background. Why is SaaS the platform that we've chosen? First and foremost, we don't have a choice, right? When you're dealing with AI and natural language processing solutions, this requires a significant amount of computing power that just doesn't exist with computers that you've bought and racked in your back room or in your IT office, right? We need the power of an AWS in cloud infrastructure that has these specialized computers called GPUs that are what are needed to build AI systems. So first and foremost, we don't have a choice. Secondly, really importantly, security is built in, right? With SaaS, there are no physical servers that your IT organization has to go and install and manage and monitor. This is all secured in the cloud. And part of the, capabilities that are in the cloud are these security capabilities. So we don't have to build them from scratch. They're ready to be utilized. The sort of subcomponents in the cloud are all HIPAA validated and, other, compliance standards to those as well. So it makes it easier. And with all of this, it just represents a significant cost savings from a manpower perspective and computing perspective. So it works out both for us and the customer in, using SaaS and cloud. They're sort of interchangeable. Like when you think about the cloud, you think about servers somewhere else and your app is hosted there. And then SaaS is a way to deliver that software as a service where you as an organization work with us to sort of procure that on an annual basis. And they're, a bit separate conceptually, but they've really been wound together into one concept, which is the cloud and SaaS together. And, Jim will speak to this more, but I think it really streamlines both the procurement and the management and deployment of these applications with your staff in ways that, had really never been possible in social services before. So I'll leave it at that and, hand it over, I think, back to Duke to introduce the next topic with Jim and Dan around why they've chosen SaaS.
Yeah, thanks so much, Marty and Felicia. So turning to the real world of implementation of a SaaS product, the experience of launching and onboarding SaaS is very different than a custom build. So I want to turn to Jim and Dan to talk about their onboarding experiences. So let's start with Jim.
You're on mute.
Yeah, thank you. So first off, having done SaaS solutions in the private sector, it was a natural to start looking at it. And I was very pleased to see that there's more SaaS vendors now for the government than there ever has been. And so when we got an opportunity to see what Augantel could do, it really resonated with the business. They understood exactly what they were trying to solve for. And when we saw that demo, they said, boy, if that works like they are showing it, we can use that. So we started investigating, and we are in the midst of our CWIS implementation, just as a note. So one of our biggest concerns was, how much time do you need from the agency? Because they're really busy building a new CWIS system. So we sat down, we spent a lot of time talking about exactly what would be needed, looking at what does the cadence of meetings look like, how does this work? And Augantel brought to us a 6-month plan to train their system. Basically, the beauty of what Augantel brought is, as Marty was saying, it is already fashioned to child welfare, but Illinois, like every other jurisdiction, uses its own acronyms, has its own phrasing that we do. We're Midwest. We talk a lot different than New York does. So they spent 6 months tuning that system. And in my mind, that's a configuration type of thing. It's more than that in this case, really, but that's how it felt. So when we found the system, we started digging in. We had a good plan for that. We then moved on to the other big question, which was how much configuration is available in the system. And we'll talk more about that a little later, I think. But that was an important aspect of discovering if Augantel was the right fit for Illinois. And it turned out it was. And they met their mark on the estimate. They said 6 months. We had it down to how many people do you need, from what area of the agency, and all that. And it went as planned. And being on the IT side, I have to go and ask questions about how did this go? And overwhelmingly, the business felt like they got the value for the time they spent. Matter of fact, they felt like they got more value than they had in so many other implementations. And to kind of go off of what Felicia and Marty was saying about SaaS, one of the things I like about it is, I think there's a very valid argument to say, should governments, in my case, state government, be involved in building software? That's not what we do as a business, right? We take care of people. And that's what SaaS brought to us overwhelmingly, was a product that was hit the mark, solved the problems that we were trying to solve, minimal implementation time. And we'll talk about some of the other aspects later, I know.
Great. Thanks, Jim. Dan, could you talk about your launch and onboarding experience with Binti?
Yes, thank you for the opportunity. So I loved hearing Jim's experience. It felt familiar as we began some of our initial discovery discussions with the Binti onboarding team. Frankly, there was some trepidation at first. We didn't really know. We had some other experiences with other apps and developing things ourselves that maybe were not as successful as we had hoped, and so our fingers were crossed. We were really hoping that it would go well, and they exceeded our expectations. They had a very clear roadmap, what was going to happen next, and who they would talk to when there were questions. If any of those who are a part of those initial conversations know that we had a lot of questions, and they were very patient with us and answering the questions we had, and then giving us next steps continually. That was always really helpful. And where we're more of a unique organization, so we're a nonprofit agency contracted by the Division of Child and Family Services here in Utah to recruit, train, and support families, foster families. And so our needs were not going to be that we were licensing families, but that we would be assisting families through that pipeline, through that process. And so we strategized and figured out a way to engage our local Office of Licensing agents who are all very responsive and who also really have loved their experience with Binti. But it is, again, walking us through that process, the unknown, how will this work, bringing in another agency who actually does the licensing. They were very supportive, and it was an incredibly helpful and enlightening process.
Great. Thanks, Dan. Kind of sticking with you for a minute here, Dan. You know, software is great, SaaS is great, but what's really important is impact and outcomes. I mean, that's what we're here for. So, can you tell us about the value of the partnership with Binti and what that's brought to your organization?
Yes, thank you. One thing I've really appreciated in my role as director of operations is that to understand our processes and improve efficiencies from the very first pre-screening we have with potential families through training and then through all the paperwork. We're looking at all of those funnel points, and it's helping our funnel go from this to a little bit wider a funnel, so we don't lose families in this process. And that's exactly what the Binti tool has done for us. It's helped us understand where families are in the process, eliminated our spreadsheets and unfortunately handwritten notes, tracking some families and some systems, and has really given us the ability to have a more standardized process across the state, and to be able to dive into each of those steps, each of those funneling points, to ensure that we aren't losing anyone. I think it's clear across the nation how challenging it is to recruit and train and keep our foster families. And so we really have to, it's in our best interest and the best interest of the kids in their care and the foster families' care that we do, that we pay attention to all those points. And so it's helped us magnify our mission far more than we've been able to do thus far, and in a time when it's needed the most.
Great, thank you. So turning back to you, Jim. So from an IT leader's perspective, can you talk about some of the advantages that you see for you and your team in embracing a SaaS solution?
Oh, muted. You're muted again, Jim.
Yeah, I know. Yeah, thanks for asking. So for me, one of the primary things is risk transfer. So by leveraging SaaS, I get to move certain risks that are actually very difficult to manage at a state level due to fluctuating budgets, fluctuating staffing levels, and things like that, such as maintaining system availability, right? This is a child welfare. We go out and do investigations 24/7. System has to be up all the time. Do we do that? Our current SACWA system has a great record of that. A lot of work, a lot of expense. Disaster recovery. We push that over to the SaaS vendor to manage for us. Security. Marty talked to security of that. They spend a lot more money on their security than we can as a single agency. So they handle that side of it. Now, I do want to call out, and I'm sure the other IT folks on here know, that doesn't mean we don't have any risks. We have to, but it shifts it from actually doing that work to monitoring that work, having our service level agreements, having security checks and those kind of things. But that's something it turns out a government agency is actually pretty good at, is assessing and monitoring. So it felt like a really good shift to keep us as an agency focused on the things we're good at and handing off those things that are more difficult for us to do. It also reduced the staff time to develop a system. I think Felicia did a great job of explaining. Augentel's doing the same thing. They're building so much functionality from all of their customers' input. Customers are running into things before we do. Voila, they show up in our SaaS solution. And we get that because of our ongoing licensing. It shows up before we even had to ask for it often. Also, they're here listening to us and taking our input and talking about ways to advance their platform as well. I don't have to have that staff. I don't have to have that highly skilled staff, which I'm sure from talking to others, it's the same in many government agencies. It's hard to hire that kind of staff into the state and retain them. I'm counting on my SaaS providers to bring that expertise to the table for us all the time. Plus, they have a large group of people developing these changes so they come much faster than we could do it. And if you've worked on, I know I got it, and I'll quote the source, Gartner expressed to us, 70% of government projects over $60,000 fail to meet the schedule or the budget or the scope, or all three, right? That's just the reality we live in. A SaaS vendor, they won't be in business if they do that. So that's what you're getting with that, and at a monthly pace rather than millions of dollars up front. I'm checking my notes here. Another aspect I want to talk about that SaaS is offering us that has really excited our agency is there's a paradigm shift that occurs. Before SaaS, business wants to, or has to, right, through regulation, wants to try a new idea, try to adapt. They come to IT 6, 9 months, a year, and we'll get that into a system so it'll help you. What do? They can't wait a year. They're not given that option. So they use spreadsheets. They use Microsoft Access. They use whatever they have to get the job done. And then IT comes along and says, I got to clean this up. This is an enterprise level. All those problems. SaaS changes that paradigm because they're so focused on configuration that they come to us with an experiment. We can actually make the system change quickly if it fits into that configuration. And that's my call out when we talk about SaaS, that I think is one of the most important things that you do is to look at their system and determine if their configuration abilities match to where you see volatility in your business. In Augentel's case, it almost matched perfectly. We were able to adjust it to our needs. For example, being able to build queries that are right there and handy that are specific to what we're looking for was so valuable. So that was one of the things that I highly recommend that you look into is, are they configurable? The other call out is check with their customers to make sure that their estimates are kind of close. I've had the experience where a SaaS vendor comes in and promises it'll be here in 6 months. It isn't there in 6 months. I won't call out SAP, because that'd be rude, but there's an example, right? Augentel came to the table, and I know from listening to Dan, same thing with Binti. We worked hard on that plan. They lived up to it and delivered it on time, which that feeling that you have of professionals on the SaaS slide, because they were able to meet their estimates, they were able to deliver the value they promised. That makes adoption in the business so much better, right? Because I'm sure every technical person here feels the pain of adoption. We build a great system, but nobody wants to use it because it's different. These kind of things just really added great to that experience as we implemented Augentel.
Great. Thanks, Jim. I love that that ability to use your SaaS vendor to innovate quickly instead of submitting a change order, waiting a year, finding money, and hoping it works at the end of that time period. Which is, I know, was my experience as a commissioner. Every new idea that we had, went into a hopper of prioritization with our M&O vendor. I had to find the money from the legislature. So, it's really is a shift in the model It allows things like innovation with Binti and natural language processing with Augantel to happen quickly. So it's really, really an amazing paradigm shift. So thank you. So we've talked a lot, like conceptually, about how a SaaS product works, how it's launched, what the advantages are, but there's nothing like actually seeing the product itself. So I'm gonna turn it over first to Felicia to give us a little sneak peek into Binti, and then we'll turn it over to Marty. Thanks.
Sounds great. All right, I'm going to do a very speedy sneak peek. As Duke mentioned, a full demo would be probably 2 to 3 hours. So I'm going to do like a 5-minute version of a couple of our modules. So I'll start with licensing, and I'll give you a sneak peek of a few slides, and then also how it looks for a family and a social worker. I'm going to share my screen here. So before Binti, families are applying on paper. Social workers are using a 70-column Excel spreadsheet to track families through the process. And essentially what we built is the ability for families to apply online, e-sign their documents, upload copies of their ID. And it's not just for the families, it's also for other adults in their home who need to complete paperwork, references who need to complete paperwork. The families will just list the names, email addresses, click send. They'll get an email, they'll fill that out online as well. And then for social workers, they can see a dashboard of all the families in the process, what's done, what's not done, what they need to follow up with, track the background checks, complete their paperwork online. We have robust reporting for agencies to track families through the licensing process, including, how many families are we recruiting, where are families on a map, how long is it taking to approve families, why are families dropping out. And Binti is mobile friendly across all of our modules. So on the left, you can see for families what it looks like for them going through the process, and on the right for social workers. Just to note, families can also be in different languages. So we have quite a few agencies where we support the whole process in Spanish, but if you have other languages, we can support that as well. Now I'm going to show you for licensing just a really sneak peek of, clicking around a little for a family. So I'm logged in as a family here that's about to start my process, and I can see, I have the application, I have instructions for fingerprints, I have a health questionnaire, I have a document I have to sign, I can register for trainings. There's documents that the worker signs first, and then I would sign. There's documents I need to upload. And by the way, all of this is configurable to our point on configuration earlier. So, obviously every state has different forms and different documents they require, and we would configure those specifically to your agency. They can list other adults in their household, and this will trigger an email to them to complete their paperwork. They can list children in their home. And then they can list references that need to fill out a character reference on them. And they can fill it out, click send request. That reference will get an email. They can fill out the reference online. They can fill it out on their phone. This is one of the favorite features for social workers, because before, a lot of this was done over physical mail, and they'd be mailing references and they'd have to mail it back. And now families listed there. It gets sent. We'll actually remind the reference up to 3 times, and most references do it on the first or second time. So, and they just magically show up in the dashboard for the worker. And I'll click into just, one of these here. So in the application, and you can see actually my first and last name are filled out because I filled that out when I signed up as a family. Binti only asks information once, and then we'll populate it in all the relevant places. And when I'm done with this, it would prompt me to e-sign. I'm just going to pop over to the social worker side. So I'm logged in as a social worker here, and I can see on my dashboard, what's my caseload, what are things I need to follow up with that are falling behind. It's been over 90 days since these families signed their application, and I should follow up on those. I have no renewals overdue. That's exciting, but I have one that has an expired document that I should follow up on. So it just gives people a quick glance of kind of what they should follow up on. And then I'll go over to the whole caregiver application section. And this is where you can see a list of every family in the process, and then exactly what's done and what's not done. So for example, this Shannon here is done with 70% of the form, 16% of supporting documents. None of the references are done for the 10 trainings, background checks. Agency forms are forms that the worker would fill out. And yeah, I won't go into everything, but a worker can easily complete background checks, log trainings. They can see different reports on the family as well. And then I'm gonna just do a sneak peek of family finding as well. Oh, and this was, I mentioned this before, but our licensing module, the one that I just showed, it has grown to over 450 agencies in 34 states, including 10 states statewide. And we serve about 38% of the country with that module. We do quite a few things. This is a list of all the different modules we do. But I'm gonna, in the interest of time, just focus a few minutes on family finding and then pass it over to Marty. So family finding, the genesis of this is basically trying to increase kinship placement rates. The national average is 35% placement with kin, but we think it's possible to get a lot higher. And we've seen some interesting pilots around the country where people have placed higher percentage with kin. And what we've seen is agencies are doing it extremely manually. We've spent time shadowing 40 different agencies in 10 states. And most of it's being done on paper, Excel spreadsheets, cobbling together different tools. Even the agency we talked to that has one of the highest kinship placement rates, and they have 100 full-time family finders, are cobbling together 4 different disparate self-grown systems to do different parts of the process and spending 30% of social worker time re-entering data across the different systems. So we felt that there was a need for an end-to-end tool to really drive higher kinship placement, but also save social worker time. And this is also an area typically not included in a SACWIS or CWIS system. So we felt it could be complementary to pretty much any state. And so basically how it works is with Binti, we integrate with Clear. So pretty much all agencies we've seen either use Clear, Accurate, or TLO as people search databases to find more potential kin. The problem is those systems spit out 100 pages of results, and it's really time consuming to sift through those results. And then you have to manually enter the results from the report into whatever tool you're using to track your notes with those families. So with Binti, we integrate with Clear's API, and you just search in Binti for, let's say, if you know the mother's name, and then it will find potential kin, easily synthesize it for you, and you can import in the ones that you want. You can also manually add families that you learn about yourself. You can do bulk outreach to the family. So instead of sending each text, each email, each printing each one that you need to physically mail one by one, and then logging each case note of each of those outreaches, you can just send one text and Binti will bulk send it to all of the 50 potential kin and automatically log those case notes. So this just saves a lot of time in the initial outreach. Workers can see a list of all the searches that they're working on, how many people they found. We'll show you every contact that you've made in a family finding search. We'll show you every relationship you found for the family, for the child, what level of support they're open to, above and beyond just placement, including visitation and financial support, etc. We'll generate a family tree automatically, which can help you figure out which branches you might need to dig in more. For example, if you found a lot of people on the mom side, but no one on the dad side, will prompt you to dig in more on that branch. And then you can track background checks, refer to the licensing module if you use us for licensing as well. And we automatically generate reports, both, reasonable efforts reports that you'll need for court for each case, but also as an agency, how are you doing on kinship placement rate, number of connections you're finding per child, etc. Overall, we estimate we can save 10.5 hours per family finding search of staff time. And ultimately you can, have workers focus on what they got into this field to work on, and less on the administrative work, and find more kin for children. So I'm going to pause there. That was sorry for talking so quickly, but wanted to get through a lot, and would love to pass it over to Marty. Oh, you're muted.
Thanks. I'll go ahead and share my screen and start the Augentel demo. So if you remember before, I had said that there are 2 elements of the system. One is targeted for use by frontline staff, and the second is used by supervisors and quality specialists and individuals in leadership positions. But What you're looking at here is not another case management system. Think of it as a content intelligence system that sits on top of your current system of record, most likely a SaaS or CWIS system, and identifies the critical information that's buried in that system. Workers don't need to do any double entry to make this work. This is using the data that already exists in your case management system that your staff has already collected. So I'm going to look at the Dobson family. This is a particular case that has been assigned to a caseworker, and put yourself in the shoes of a new caseworker who's been assigned to that case. No background. All they have are some, allegorical information from a supervisor or from the previous caseworker, and they have to figure out what's going on, and they're about to make a visit with the family. What you're seeing on the right here are all of the different bits of narrative data from your CWIS system, whether they're case notes, assessments, reports, et cetera, and presented in a really easy to use way. If you click into any one of these notes, you can scroll through notes one by one by one. And as you probably experience with your current SaaS system, that just takes a lot of time just to get access to the notes. So we make it really easy to just review them. And what the natural language processing system is doing is in the background going through note sentence by sentence by sentence and looking for sentences that describe particular concepts that are important to your agency: risks, strengths, social determinants, and highlighting them. So here we see that this risk of a TPR was highlighted, and that's a risk to the family. So the system highlighted this sentence and labeled it as the risk factor parental rights termination. Below here, there is a sentence that has highlighted a sentence that is discussing the topic of mental health, another risk factor. But here it looks like the mother is able to care for the needs of her child. So this is a protective factor. And we're doing this through every single note across your entire agency for data in real time and historical data as well. We're also identifying individuals. So any person that's highlighted in bold is an individual in that case, and we're highlighting all of them, as well as all the different names that ways that individual has been described in those notes. So making it easier to find those individuals. First and foremost, the first thing when we met with our first customer, they said, listen, can I just have search capability with my data? I don't have that in my system today. So we provided Google search-like capability for all of the notes. And what you see here is, if I type in the word drug, you're seeing not only the keyword drug. So it's important to understand that we're not just searching for keywords. We're searching for anything that's conceptually related to that topic that we're searching for, just like you would get from a Google search. Drug, drugs, OD, heroin overdose, et cetera, and doing that across all cases. So this capability on its own is saving caseworkers 5 hours a week that they had otherwise spent clicking through notes one by one by one to look for that information that the attorney is asking for them for, that the foster parents asking them for, that their supervisors asking them for. And we've made it just through giving search capability. On the left, what you're seeing is really like a summary of each one of those risk factors or protective factors over the span of the case. So this case spanned from 2022, December 2023, and you see all the different risk and protective factors. So this gives a visual view of the progression of each one of these concepts that may be important to the agency, as well as any one of these bubbles are clickable. So you can get to those exact notes when you need them, whether you're in court or meeting with the family, which was just not possible before. We're doing the same thing for individuals. We're highlighting every individual that's been mentioned in any case note across the case. And this is really important for family finding. We found that some of our customers are able to triple the amount of qualified placement candidates because we just sourced the names of anybody who's ever been buried in the notes. And this had been a manual process before that we've now automated. So this is what a view looks like for an individual caseworker. When you're looking at data across an agency, it's really important to understand trends, where there are early warning signs, where there are problems pertaining to how well your agency is following particular processes. And I'll share an example: sleep safety. Today, as we know, it's important if there's an infant in the home that the caseworker is addressing sleep safety. And there's no structured field for this data. There's no checkbox for this. It's all in the notes. So what we're doing is looking across every single case, looking across all the narrative, and looking for when an infant's in the home. And if an infant's in the home, checking to see if the caseworker has documented that they've addressed sleep safety. And most of the time, great, they're addressing it. But there are those 4 cases where they haven't addressed it, and that's a problem. So we give the ability to go and dig into those particular cases to see which ones have not had that topic addressed. And here's that list. And then you can go back and look at those cases and see. I'll go back to the Dobson family. We actually create this feedback loop of quality where those particular, early warning signs are pushed down to the caseworker so they can go address it on their own. So here you see all of the different, quality issues that have come up so that the caseworker can go ahead and address it. And this covers, issues around processes like addressing sleep safety, but also topics that are important to staff, such as worker safety. Is there evidence in the notes that the home that caseworker is about to visit may not be a safe place? Maybe they should take a supervisor or someone from public safety with them. So what we do is scan every single note for whether there has been worker safety issues, or whether there are some, risks there around safety, and proactively letting that caseworker know that they should potentially bring someone with them. We can highlight best practices. Another good example is just looking for note quality issues, notes where there may be they maybe have been cut and pasted, or where the notes were incomplete, and being able to provide that feedback to quality specialists and the caseworkers themselves. And these, capabilities are built for the agency. So we've built, many different queries for Illinois and our other customers, looking at, CFSRs, looking at death reviews, et cetera, so that you can automate that process of finding the important data rather than the old way of doing it, which is just sampling notes and looking for that needle in a haystack. So, I'll sort of summarize with that, what we're doing is making the data accessible to frontline staff and leaders across an organization so they can make actionable decisions where that capability was not possible before, while at the same time improving the sort of administrative efficiency of the organization. And I know Illinois is, I said that they're saving 20% administrative overhead, which is a significant amount of time just by being able to give streamlined access to the narrative data. So I'll leave it there. I do want to leave a few minutes for questions, and thank you everybody for talking with us today or meeting with us today.
Yeah, thanks, Marty. And I just do want to underscore that time savings for workers. I know Binti, we've documented up to 40% time savings of workers who are using our modules. And with the national crisis that we have, with having a real challenge in recruiting, retaining workers, every hour that we can save is an hour that's freed up for that really important social work and getting rid of that paperwork. So I think that's a really significant advantage. Please, in the Q&A, we've responded to a few questions already. Please type in your questions so that we can spend the last couple minutes making sure we answer them. I also know that both Binti and Augentel are happy to follow up with anybody and delve deeper into our products, answer any questions about SaaS and its implementation in any way we can serve you. That's our shared mission. If we could, David, if we could pull up the last couple slides. Just wanted to highlight, pull out some of the advantages of SaaS that we've talked about today. One is the ease of access, how it's available with an internet connection on any kind of device. It's affordable because we spread out the cost of implementation and support across all of our customers. So we're able to drive down that cost and provide a dedicated team to support your implementation, which is a lot greater than the team you'd be able to support yourself in your specific agency. rapid deployment, both Augmentel and Binti examples today where we were committed to implementing in 6 months or less. And that brings time to value to you quickly. You shouldn't have to wait years to get the services that you need and the support from your software. That should be available to you as soon as possible. I also think it's significant that you can adopt new technologies and drive innovation without that significant in-house investment and the inherent risk that comes with that. The license costs are inclusive. Ongoing enhancements, customer support, white glove configuration to get you up and running, hosting, disaster recovery. All of these are included in an annual license fee for a SaaS like Augmentel and Binti. And that allows decision makers to budget with certainty. I mean, one of the things that I always thought was a big challenge for me as a commissioner was the unanticipated costs of policy changes from the federal or state level that had to translate into change orders. You can reduce your staff IT burden. Cloud hosted has inherent advantages, including being scalable and secure, and you avoid accumulating technical debt that you're going to have to maintain over time. Last slide, please. There was a question about procurement considerations. One of the things that we've seen is that the traditional procurement language doesn't always take in consideration the way that SaaS works. So think about the way that you're writing your maintenance and operations procurement language to include an option for SaaS provider to provide that O&M at no additional cost to you under their license agreement. Avoid requiring source code and intellectual property from being turned over to the state if you're choosing a SaaS model. Include time to value as an evaluation criteria, and recognize what an advantage avoiding technical debt is. I know we're at time. This webinar will be posted on the APHSA website. I want to thank our panelists for doing a terrific job, and thanks for each of you for staying with us and participating and really considering how SaaS can help you transform your services quickly in an innovative way to improve outcomes for families and children across the country. Have a great day, everybody.
On behalf of APHSA, I want to thank our panelists for their contributions. I'd also like to thank all those in attendance. I want to remind you to register for our National Human Services Summit next June and to consider submitting a proposal. I also want to remind you, as David mentioned, that you all will receive this webinar in days ahead in an email. So look out for that email. Have a wonderful day. Thank you.